Host at the U.S. Fish and Wildlife Service La Crosse Fish Health Center down in La Crosse, Wisconsin, and like was mentioned, I'm here representing the Fish Health Committee as the outgoing chair to address an issue of EEDV potential implications for stocking Great Lakes waters. And a situation arose due to an outbreak of EED at State Fish Hatchery in Michigan, and some questions have come up. So, clinical signs of epizootic epitheliotropic disease, and that's the last time I'll pronounce or say that whole name because it's a tongue twister to say, so from now on it's EED. The signs of EED, the gross pathology is it causes gray, white blotches on the skin. You also get telltale eye hemorrhages in the lower quadrant, as well as frayed fins. The fish become lethargic and have sporadic swimming behavior, as well as some secondary fungal infections develop as well. Histopathology, if you look at this microscopically, you'll see epithelial lesions as well as necrosis of the epithelial tissue. So in the 1980s is when EED first kind of got everybody's attention. It decimated lake trout hatcheries in Wisconsin and Michigan, both federal and state hatcheries. Losses were near 100%, and if losses didn't reach 100%, they were approached, and then the rest of the fish were basically euthanized just because of the risk of the bacteria or of the losses. It's very tough to figure out what was causing the disease outbreak. Any of the traditional media that were used to culture viruses or bacteria were unsuccessful. Eventually, through electron microscopy, they determined that it wasn't a herpes virus or EEDV as a causative agent. So examples of herpes viruses, there's quite a few of them in the fish world. In the ictalurids, such as channel catfish virus, there's several salmonid herpes viruses. This particular one is also referred to as salmonid herpes virus 3. There's also herpes viruses in sturgeon as well as cyprinids, amongst others. It's also in humans, such as the chickenpox virus or VCV, which is in youth it causes chickenpox, and then the virus will go into a latent stage and maybe come back potentially in 10 to 20% of the population as shingles when the population gets older. There's also other herpes viruses are the viruses, the herpes simplex virus that causes cold sores in individuals. Once you have an outbreak of cold sores, the virus will go latent and potentially come back again during some stressful event and have outbreaks of cold sores. So they're quite common throughout the animal kingdom. So in fish herpes viruses, they're usually quite specific to the host. In this case, it affects lake trout hybrids experimentally. Other salmonids appear not to be affected at all by the virus, which is pretty common among, again, like I said, fish herpes viruses. Latency is when basically the virus hides in host cells, and what I mean by hides is it deposits its genetic material into the host cell's nucleus. So there's actually no viral particles present during latency. Instead, just the genetic material is present, and something causes the virus to basically be produced by the host cells and again produce virus particles. Traditionally, these are usually host cells such as neurons or white blood cells, but there are other tissues as well. In fish herpes viruses, transmission is generally thought to be either horizontal and or vertical. Horizontal being close contact, fish-to-fish contact, or shedding fluids into the water. Vertical transmission is from parent to progeny through the egg. The virus is actually inside the egg. And basically, traditional egg disinfection with iodophore is not effective at destroying the virus because the iodophore cannot penetrate the egg. And this mode of transmission is unknown for quite a few of the herpes virus, and EEDV is no exception. So the model program for fish health in the Great Lakes, the 1993 version, the most recent version, considered it a restricted pathogen, meaning that it was present in the Great Lakes, and basically if it was detected, it was to be destroy all the lots. In 2012, moving ahead, it was classified as a provisional pathogen, meaning that there's not a lot of information known about the pathogen, and we could not make necessarily solid recommendations regarding the virus. Instead, that the decision should be made on a case-by-case basis, and also apply a risk assessment to kind of determine exactly what some of the risks were and maybe how those risks can be mitigated. What changed from 1993 to last year? Development of Diagnostic Tool. Pre-2008, to detect EEDV, you had to have a clinical outbreak. You had to perform histopathology and then do electron microscopy to detect the virus. An outbreak at the Les Voigt State Fish Hatchery in Wisconsin in 2003, which was initially diagnosed as bacterial cold water disease, was later determined to be EED as a causative agent. From that outbreak, researchers at UC Davis were able to develop a PCR assay or a molecular test to detect the virus. So just a real quick timeline before the situation at Marquette. Severe outbreaks in the 1980s of EEDV at Great Lakes hatcheries. The outbreak at Les Voigt in 2003. PCR assay becomes available in 2008. 2009, again, detections were made at Les Voigt. This time there was no clinical disease associated whatsoever with the fish. Detections in Wyoming, it's a long story, I will not get into those, which led to detections in a hatchery in Pennsylvania. Those fish were subsequently destroyed even though there was no clinical disease. Detections were made in Lake Michigan wild fish during surveys. And detections were made this past year from fish collected from Lakes Erie and Ontario. So basically, all the Great Lakes other than Lake Huron have tested positive for EEDV. So the Marquette State Fishery outbreak was initially observed mortality in September of 2012. The bacteria were present on gills and also detected Flavobacterium psychrophalium. No viruses were detected, and the treatment to treat the bacterial for bacterial gill disease or bacterial cold water disease were ineffective. The mortality persisted, and in November 2012, signs consistent with EED began to develop, such as irregular swimming, pale patches on the skin, the eye hemorrhages, as well as secondary fungal growth. Mortality at Marquette, again, here's just the mortality curve provided by Gary Whalen, showing the mortality began in mid-September and terminated in most cases by early January, or by, I should say, terminated overall by early January, but most cases in most lots terminated in early to mid-December. The mortality approached anywhere from 15 to 25% during this time in the different 5 raceways that were affected. So to follow up with this outbreak, Michigan DNR undertook some sampling with the qPCR assay to test, and in the brook trout at Marquette State Fish Hatchery, looking at 24 pools from 2 units of the brood stock, all those were negative. The production brook trout at Marquette were also negative. Splake, the lake trout, brook trout hybrid, was also negative at Marquette. Lake trout brood stock, there was 2 rearing units that tested positive, as well as all 5 production units tested positive, which would not be a surprise because all 5 rearing units showed clinical disease in the fall. And those ranged from, in the Seneca Lake strain, from 21 to 78%, and then in the Lake Superior strain, from 10 to 97% in those 2 units. Some follow-up sampling at Marquette that's taken place. Additional samples of both strains, Lake Superior and Seneca Lake strains, 60 from each strain. There were no positives when they were sampled in late January. In early March, lake trout yearlings sampled the Seneca Lake strain. There were no positives, but 2 positives of the Lake Superior strain were detected of the 60 fish. Results are still pending from the fry that were the 2013 year class fry that were collected at that time. I'm still waiting for those results, as well as looking back at some archive samples from May of 2012 last year of Seneca Lake. All of those were negative as well, of those 60. So Lake Huron Technical Committee, how the Great Lakes Fish Health Committee got involved. Obviously Michigan DNR notified us in December that they did have an outbreak of EED at Marquette. The Lake Huron Technical Committee sent a request to the Fish Health Committee looking for a recommendation as to what to do regarding some proposed stocking of lake trout from Marquette State Fish Hatchery into Lake Huron. It was discussed at the Great Lakes Fish Health Committee meeting in February, as well as a conference call that occurred later on in February. Each member was asked to complete the risk assessment and came up prior to the call. And the numbers ranged from the lower numbers here of 320, which are all these numbers in blue are actually considered moderate risk on the risk assessment score, how it falls out on the table. The numbers in red, it actually falls out as high risk. This number here, 480 in black, one of the individuals on the committee skipped the question, so we really don't know, and that actually puts it right in between, kind of right on the line, so we don't know exactly where it should fall. Through doing this risk assessment, I identified some of the key concerns that members would have, and I'll discuss those coming up here in a couple slides. But the recommendation that came from the Fish Health Committee is that lake trout should not be stocked, or from Marquette State Fish Hatchery should not be stocked into Lake Huron waters. And that was a non-consensus recommendation. The vast majority of agencies present on the call felt that that's what the recommendation should be, but it was not 100% consensus, so that is, I guess, what it is. The question came up even though we were not officially asked for a recommendation for, say, Lake Superior or Lake Michigan. The question was asked because some fish from Marquette are also stocked into Lake Michigan waters. There were no direct discussions concerning those, but it was discussed at the Fish Health meeting and conference call indirectly through some of the Lake Huron discussions. So what ended up happening is members were canvassed by email, and one member actually did do the risk assessment and actually came out as moderate risk for both lakes. But the recommendation here was to acceptable stock fish from Marquette State Fish Hatchery into both Lake Superior and Lake Michigan, and that's primarily because it was previously detected in both those lakes. Again, this was a non-consensus recommendation. I probably use the term recommendation loosely because there really was no direct discussion as to what the recommendation would be. This is just an email canvas of all the members. But again, kind of was, I think it was about 75% of the members felt that it would be acceptable to stock fish into Lake Michigan and Lake Superior. So arguments against stocking fish from Marquette State Fish Hatchery. There's a vast lack of knowledge regarding EEDV. We don't know anything about the distribution. It's thought to be endemic, but it hasn't been found in Lake Huron. Granted, the sample size is small. It's about 60 fish, but we have detected it in Lake Michigan with a sample size of 80 fish. We have limited data as well as to what tissues to sample. Kidney or skin, or is there some other tissue where latency might occur? We really don't know. It does appear that skin is better than kidney. Large-scale mortality was observed at Marquette. I think it was approaching, I believe, close to 0.1% a day at one point. So losing up to 25% of your fish in some of those lots is a significant mortality event over just a couple-month period, as well as the stage of the virus at Marquette. The fish appear to be recovering right now, but nobody knows. Are the fish developed immunity? That's why we're not seeing any more clinical disease, or has it gone latent? And depending on what state it is it still releasing virus particles into the environment, or has it truly gone latent? As well as the effect on future wild fish populations, since it's not known that if the virus is vertically transmitted or not. There is that risk as well, that some members had brought up. Arguments for stocking fish from Marquette State Fish Hatchery into, say, the Great Lakes. The EEDV biology and history indicates that it is endemic to the Great Lakes, and it is the general thought, but again, Lake Huron has not tested positive yet. It's species specific, and there's been no documented epizootics in wild fish populations. It's only been shown in hatchery populations. EEDV has been detected in 4 of the 5 Great Lakes, again indicating that it's probably endemic. And the Marquette State Fish Hatchery case history information regarding the outbreak. The mortality began in September with clear clinical signs. Those clinical signs, or I guess the mortality ended by by mid-January of 2013, and the disease signs completely disappeared by February of 2013. They're currently showing a reduced prevalence in those fish, again indicating that probably that it has gone latent, as well as high condition factors observed in the fish indicate that there's probably the fish are recovering and there is not a current outbreak going on at this time. And I should note that most of this information here on the arguments for stocking was prepared in a document that Gary Whalen submitted from Michigan DNR, and this is kind of represents other people on the committee did feel this way as well. But this, I think Gary circulated that through email to numerous people, so I have copies of it I can share with people, but there'd be more information on this as well in there. So basically what it boils down to when trying to make this decision is there's lots of unknowns regarding EEDV, and that's probably why the Fish Health Committee could not make reach a consensus on what to do regarding stocking these fish. It boils down to where has EEDV been detected, because in Lake Huron where it hasn't been detected, the Fish Health Committee, the majority feels they should not be stocked, and in Lakes Michigan and Superior where it has been detected, the Fish Health Committee feels it would be acceptable to stock them. So I guess, I don't know if I've answered anybody's questions, but with this presentation, but I'd be glad to see I have a little bit of time yet, so I can take some questions.